Thanks everyone for joining today's Bench2Market talk. This is the second in our series this year, and today we'll be talking with three incredible co-founders from academia. This is our Journeys Through the Trenches talk for tips for success in commercialization. This talk series is organized by Biolocity, as well as the Georgia Tech IBB group and Georgia CTSA. A few other reminders before we get started. Biolocity offers some legal office hours with Emory School of Law professor Nicole Morris. You can sign up on our website. The link is down at the bottom, and Dr. Morris is able to answer any questions you've got about a variety of different legal topics. We also have our own pro bono innovation office hours. If you've got a technology that you think might be commercializable, even if you're not kind of ready for prime time, so to speak, you're always welcome to sign up for a meeting with our team. Meet with our entrepreneurs and residents, and we can help brainstorm with you some potential paths for commercialization. Biolocity is also a part of the extended BARDA Drive Accelerator Network, so we can provide some soft handoffs to their funding opportunities as well. You can find a full list of their areas of interest on their website. We also publish a copy on ours. And if you think that you might be a fit for BARDA funding, please feel free to reach out to our team, and we can connect you. I'd also like to remind everyone that the Biolocity funding cycle is now open as of this week. If you're familiar with our funding cycle, this year might look a little bit different. In place of the normal technology consultation meetings we've streamlined our process a bit, and we'll now do a video pitch submission, a lightning pitch submission, that will be evaluated by our oversight committee. And so please either scan the QR code or you can reach out directly to us for more instructions on how to apply. But we really look forward to evaluating some new technology. I also wanted to highlight here, we've got a special funding opportunity for technologies that could address single ventricle defect or other congenital heart defects. So if you are working on a solution in that space, we really highly encourage you to reach out and talk with us. Our next Bench2Market talk is going to be all about location, finding incubator space for your fledgling startup. This will be on November 20th at 12 p.m. So please feel free to register on our website. All right, so for today's talk, I'm happy to introduce three incredible founders of their startup companies from academia. We've got Dr. Pooja Tiwari, the COO and co-founder of ARNAV Biotech, Dr. Eric Ortlund, co-founder of Allonix, and Gaurav Byagathvalli, the CEO and co-founder of Piezo Therapeutics. So without further ado, I will stop my presentation here. And I'd like to start by just kind of going around the table and give each of our entrepreneurs a chance to introduce themselves and the companies that they're working on. So in no particular order, maybe I'll start with you, Pooja.
Yeah, hi, John. Hey, everyone. Thank you so much for inviting over this bench talk. And I'm so excited to talk and share my experiences and whatever do's and don'ts I have in my kitty. So I'm Tiwari. I have a Ph.D. from Alabama State in microbiology at Georgia Tech for almost 5 years as a research scientist and postdoc. And during this time, somehow I was wondering, like, okay, what else can I do besides doing my academic research? And the idea was kind of brewing inside my head to start my own company, get out of the constraints. There's definitely like pros and cons of working in an academic setting versus in a startup. But overall, I just thought that there might be a few things that I might take closer to the clinic if I worked in a company rather than working in an academic setting. So I'm happy to be here today. Thank you.
Thanks, Pooja. Eric, how about you next?
Sure, I'm Eric Ortlund, professor of biochemistry at Emory University. I was trained as a chemist and structural biologist, and what I like to do is solve three-dimensional structures of enzymes, DNA, protein, receptors, figure out how they work, and then hopefully design therapeutics. Co-founded a company, Allonix, which designs small molecule modulators for targets in an effort to modulate autoimmune disease and metabolism.
Awesome, thanks. And Gaurav?
Yeah, thanks, John. Also, thanks for nailing my last name. That might be the first time I've heard it right in the last year. So,
wow.
But yeah, I'm Gaurav. I'm the CEO of Piezo Therapeutics. My background is a bit different, I would say, than most other founders. I got my start in synthetic biology and then ended up in the world of drug delivery. But I actually don't have a PhD. And right before we had spun out Piezo from Georgia Tech, I was working at an investment bank in 2022, which was, I would say, a fascinating year to be in the world of finance meets biotech, because we went from IPOs to restructurings in a very short period of time. So we launched Piezo out of research that we were doing on improving the delivery of DNA and RNA medicines, particularly vaccines. So a lot of it was global health focused. Since then, the company has launched a seed round and taken quite a few different directions, really to address challenges on the delivery of RNA without nanoparticles. So happy to be here and touch on some of the, I would say, crazy things you learn that people tell you and people also do not tell you after you start a company.
I love that. What a great segue. So we heard some of this in your intros, and thanks for giving some background from each of you. But something I think is interesting about startups that are born in academia is there seems to come this kind of point where you're doing research. You were touching on this, Pooja. You're working on an important problem. And then at a certain point, you think, if I'm going to really make an impact with this, if I'm going to translate it, I need to sort of spin this out into a company. And that timing question about when to incorporate, when to start building a team, I think is a big question in a lot of researchers' minds. So maybe I'll start with you, Pooja, just because you mentioned this. When did you kind of know that you needed to incorporate a startup, that you couldn't really take this further in the academic research setting?
So for me, I think one of the what would probably be like a light bulb moment happened during my PhD. So my PhD was on respiratory syncytial virus. It's a virus that infects almost all children under the age of 5 and elderly above 65 and immunocompromised people. Recently, we were very fortunately have a couple of vaccines that recently got approved, but most of them are approved for elderly people above 65 years of age. And there's a maternal vaccine that mothers can take to protect their newborn babies. But still there's a gap where like the people who are infected, or rather children who get infected, there is no available or no approved therapeutic. And I'm talking about my PhD work back in like 2010 or something, right? So then these vaccines didn't exist. And what we were working on, trying to deliver different kinds of vaccines as well as antiviral therapeutics using nanoparticles. So during that time, we found out that our RSV uses a mechanism by which it enters into the cells. And for that, it uses our own host cells to fuse with them. And there's actually a step which if you interfere with, the virus can no longer infect these cells. And we throughout my PhD, my work was to identify what can we do to stop this process. Because if you stop the virus right at its entry point, you can probably stop the infection, and RSV causes severe inflammation. So if lesser infection means obviously the inflammation will be lesser. So during that time, we discovered that there is a small piece of molecule that we can use that will block the virus right in its steps before it enters the host cells. And that was the moment we thought that, oh, this is like, a good therapy for preventing RSV infection. So I still remember to this date, the first time I did this experiment, I did not see any RSV in my treatment groups. And I obviously, like as a naive PhD student, I was super excited and took my results to my boss. And he was like, who's our current CEO, Dr. Sri Singh. He was my PhD mentor as well. And he was, I don't believe this, just some fluke. Maybe you just forgot to add virus or something. And I'm like, no, I'm pretty sure I did. And, you question your own sanity if you get too good a result to believe, if you're a true scientist. And I'm like, you know what, maybe I did something wrong. And then I literally had to repeat these experiments for more than 6 months. And then we found the same results over and over again and again. And that's one of the moments we found out that this is something we found which could potentially treat these children right when they are, severely infected. And remember, we're talking about babies. These are like newborn babies up to 5 years of age whose lungs are tiny, right? Their lungs are like probably smaller, I don't know, maybe like a very small fruit size, and they cannot breathe if they get infected. So that was the moment we thought that this is something, worthy. And we obviously filed for a patent. And then there came a time where like it kind of was left on the shelf because I was like not planning to start a company at all. In my PhD, I was right on the academic track, finish PhD, postdoc, and they'll be a professor somewhere. And during my postdoc and when COVID happened, I was seeing that like everybody was focusing on our vaccines and trying to like find a vaccine that will prevent COVID from happening to people who are not infected. But my thought was, because my own family members in India were infected, and I was like, what about people who are already infected? What are we doing about them? And that's when we thought like, oh, I already have something sitting on the shelf. No one's doing anything about it. and talked to my boss, and he was like, yeah, let's start a company. And I'm like, and this literally happened on my couch, so I'm not making this up. And I was like, what? And then he was like, yeah, let's start a company and we can license this from our university and take it forward. So that's how ARNAV was literally born off of my couch.
Wow, what a story. So it sounds like there were almost two kind of key turning points for you. There was sort of the technology-driven one where you realized we have some really robust technology. This is actually working. This could really help people. And then there was maybe more of a personal career shift of, yeah, it's time to start a company, time to pull this out of the university and really try to find some external support. I wonder for the other panelists, maybe we'll turn to you, Gaurav. How did this story play out for you? When did you know that what you were working on at Piezo, before it was Piezo, was, valuable, it would address an unmet need? And then how did you make the decision personally to sort of dive in head first like that?
Yeah, absolutely. So, the backing discovery for us as a company is that the technology that's in a barbecue lighter can actually do the same work as a $10,000, $50,000 machine. And so I kid you not, the first paper on this was me going to Dollar Tree, buying lighters and seeing if we could get DNA into E. coli. And then fast forward a few years later, it turned into a system that could actually be used for vaccine delivery. When we started this, it was purely a global health project. The idea was we wanted something to be open source, disseminated, so that could actually have a global impact. This is where the work had originally started, actually in response to the cholera outbreak in Yemen. And so we were trying to develop diagnostics for wastewater, coupled with machine learning to predict where the next outbreak would occur. And we made all of that completely open source. In fact, if you look at the supplementary videos of that first paper, you'll see videos of me putting the whole thing together. And so really the spirit was we want everyone around the world to have access to this technology. And Saad Bhamla, who's one of my co-founders and my first PI at Georgia Tech, has really spearheaded that mission. So that's where it started. But then we had gone through the I-Corps program, which I would recommend for absolutely anybody who's thinking about starting a company, and asked ourselves, is there actually something here on the business side? I mean, we're doing science to solve science problems, but that's not how a company is run. It's really doing science to solve business problems. And so to do that, first you need to see is there a challenge on the business side that companies are actually looking for solutions to? And in pharma, some people come from a science background, but there are a lot who don't. A lot of them are actually former bankers and consultants. And so they're looking at things from completely different angles. And so I think going through that program was very informative for us to probe that and understand, in your pipelines, are there challenges that you're facing? What are the actual solutions that you're looking for? What are the characteristics of these solutions? And how do you go about actually sourcing them? And so this was around, 2020, 2021, which was when mRNA vaccines first made waves. And until then, they weren't entirely working. There were still a lot of challenges that had to be solved. And obviously, we still say that there are still a lot of challenges that have to be solved. But the key thing was, we'd done all this work on DNA, and now we're asking ourselves a completely different question. So we went in with one thesis and then came out with the other, which was DNA vaccines are going to be the solution to no, there's huge challenges on the RNA delivery side, and can we actually do something about it? But then it still took, a year and a half, 2 years to get the company up and running. And there was, in addition to a lot of business development work, there's a lot of things you have to do on the IP front, even on the research front. And I think the one lesson we took as a company that raised our round in the end of 2022, which was a very terrible year to be fundraising, and I think 2023 wasn't much better, is that the bar is very different being in Atlanta versus being in another city. And so really, I think, and John, I'm sure you know this with your work as well, it's some investors will come to you and say, yeah, we'd love to see human data first. I'm like, if I had human data, I probably wouldn't need you. So it's a bit of a catch-22 you run into. So I think really navigating a lot of those issues and challenges was key. And then we were fortunate enough to raise our seed round from a Bay Area investor in January of 23, and now it's been almost a year and a half. In fact, it was almost 2 years since when we incorporated the company, like a week or two ago. So
Wow.
it's been a long road.
Again.
And the last thing I'll say is on the front of it, you see a press release with the company being announced, and everyone thinks everything just fell into place all of a sudden. And that is not at all how anything started. I mean, this was a 6-7 year journey to get to this point, with a ton of ups and downs. And you hear about all the great things because those are publicized, but you don't always hear about all the challenges and the roadblocks you hit. And I'm sure everybody on this panel can relate to the fact that there's probably some point in time where you ask yourself, is this actually sustainable and can I really do this? And is this really going to go somewhere? And I think you got to be put in that position to then really focus and probe yourself to see, can you push this any further? And now I stand very optimistic that what we're doing is pretty significant, and I think we can really make an impact in the world.
That's outstanding. And congrats again on the seed round. Really excited to see where you guys continue to go. And I'll also say congrats on staying in Atlanta with that seed round. I'm very proud that that Piezo and ARNAV here are still local companies. That's really, really great. You make such an excellent point that people see the really public-facing, positive, splashy press releases and often don't see the sometimes decade plus of pain and misery that went to get to that point. So Eric, maybe turning to you, you might have a different perspective on this as a professor and as a Biolocity awardee as well, just to give ourselves a little shameless plug there. What did this process look like for you, kind of balancing your research goals and maintaining your faculty position at Emory while spinning out Allonix? How did that story kind of develop?
Yeah, it's a great point. You know, as a professor, my number one job is to generate new knowledge. That's what we are geared to do. And so we've always worked on important proteins, and we've done chemical synthesis and drug design, but with the goals of generally publishing papers and getting grants. So we did that for years. And one of the proteins that we work on happened to be an orphan receptor that had been targeted by pharma for a long time. Some pharma had a 20-year effort. Actually, it made major pharma targeting LRH1 and was not able to come up with a small molecule that bound well, you know, and that was able to drive activation in a relevant system. And so we had been studying this receptor just to pursue, you know, knowledge. And in 2016, we were able to solve a crystal structure of the target in complex with a small molecule. Wasn't a great, you know, activator, but through iterative rounds of structure-based drug design, solving structures in medicinal chemistry, we were able to come up with now picomolar affinity compounds that are great activators. And so, and Biolocity was part of that process. And so, you know, we were publishing those things in a sort of a stepwise fashion. And I guess funding-wise, we raised money at Emory through pilot projects, NIH funding, DoD funding, Biolocity funding, and funding from a major pharma. And so when we ended up publishing one of our better molecules, we were contacted by a major pharma company, Eli Lilly, who were very interested in the project, invited us on site. We gave a seminar. We found out that they had an effort there, you know, targeting this receptor. And we went back and forth on a way to potentially jointly pursue drug development against this receptor. Then COVID hit. So we had drawn up a nice, totally insane plan where my lab was going to do all this drug development work, which I now realize I would not have wanted to do. My lab, we still do a lot. But, you know, real drug development, you know, you're not generating lots of new knowledge. You're worrying about safety, tox, distribution, potency, and, you know, boring maybe from an academic side, but absolutely critical from a drug development, you know, standpoint. And so, so when COVID hit, that kind of iced the idea that we would, you know, start a true drug development effort jointly with the pharma company. Instead, we took a grant, and then we were funded by Biolocity, where we learned a great deal about the drug development process, which is very different than an academic program. And so then we retooled our in vivo mouse model studies, the disease model studies. We retooled our chemistry to focus more on drug-like properties. And over the next couple of years, we ended up improving our molecules to a point where we re-engaged with the major pharma company. They were still interested in the project, but asked what we wanted to do. Would we like to start a company or maybe jointly develop? And we thought long and hard about this process. We had meetings with more than a dozen, maybe VC firms, and ended up and then consulting Biolocity along the way. And in the end, we ended up going with a venture firm that brings in funding, but also expertise so that I could stay a professor. So that's why I don't have a title in my company. We co-founded along with John Calvert. And we still do important work for the effort. But a lot of the company was instantly formed upon investment, you know, in our seed round. So we raised $5.5 million through that investor, through pharma, and also through Emory.
That's great. Well, congrats as well on your seed round. And then maybe one other question for you, Eric, just before I let you off the hook here. You mentioned that you're still involved with the company, but you're obviously still maintaining your professorship. What does that look like almost on a day-to-day? I mean, how do you kind of split your time between your research activities and what's going on in the company? Are you a formal, consultant? How does that relationship kind of work out?
It's really, I think it's really N+1. I think in this role, you review grants, you review papers, you do things where you just sort of take on a lot, maybe too much. With the company work, it's a balance. So it could be up to 7 meetings a week if I attended them all, but I don't. So I selectively attend meetings, maybe 4 or 5 a week, related to the parts of the development process where I can give the most input. I make sure to empower people that either I hire through the funding we have or through Allonix to make decisions, and then consult me and John Calvert when needed. So far it's worked well. Some weeks, the drug development stuff takes over. Other weeks it takes a major, it's on the back burner while I pursue other sort of academic, projects.
Yeah, so it sounds like in either case, you're a busy guy these days.
Right. Well, you're as big, right. Busy people will stay busy, whether it's full-time academic, full-time
Exactly.
entrepreneur, I think.
For sure. So something I noticed in each of your stories is that there were these kind of decision points, whether that's pursuing a particular application. You, Gaurav, mentioned that you had done the I-Core program to do a lot of customer discovery. Pooja, it sounds like you also had a little bit of a pivot in kind of where you were focusing. So maybe we can go into a little bit more detail because I think this is it's common in every startup that you're going to have pivots, you're going to have to be nimble. But I think it's especially difficult for academic researchers to maybe wrap their heads around that because we're trained to kind of be very focused in research. And you get, at least I remember when I was a researcher, getting kind of attached to a certain project or what I thought was the application for a project. And it's hard to kind of do that pivot and sort of unmoor yourself from those expectations. So maybe we can speak a little more about that. Pooja, how did you have a similar process like I-Core, maybe even less formalized customer discovery or some mentors that helped you make this move? How did you kind of navigate the pivot?
So I think at some point I'll be like a case study of how startups are formed unconventionally. So to be honest, like I did not go through any seed rounds, I-Core or anything. So originally the plan was to like and remember this started in COVID, right? Like our company was formed October 2020. Oh, actually we just hit our 4-year anniversary yesterday.
Oh, congrats.
Thanks. And we're afloat for 4 years, so that's an achievement in itself. So we are completely bootstrapped company even after 4 years. So that's something tells us about like there's alternative ways to do a company. But again, this worked for us. Please take it with a grain of salt. When we started, we decided to like not reach out to any VCs right away because of course we needed some more data. And then we wanted to like pivot and test our molecule through mRNA and so on and so forth. So my boss had like a lab, like lab space that was available. And we started just doing something with leftover funding, leftover resources in his lab, 2 hours from here. So literally we would drive 2 hours, every day 2 hours twice. So 2 hours for going, 2 hours for coming. And that's how we were like, just doing our R&D. And because this was COVID, I was reaching out to people to see where else can I get funding, because obviously no one was going to fund a startup during pandemic. And then some people reached out to me. It was like, yeah, collaboration is all fine and good, but we need mRNA for our own stuff. And at the time, TriLink was one of the most, the biggest company who was providing mRNA. And they were busy making mRNA for vaccines for Pfizer and all sorts of things. And so they were just not taking any smaller orders. And smaller for their company, but big enough for us to be afloat. And they were like, can you make mRNA for us? You do this for your own self. And I'm like, yeah, literally that's what we do all the time. And that's how we got our first big order to make mRNA. So we kind of like have an internal segment where we also serve as a CRO. And that's how we got our first $50,000. And then I was like, Okay, so that's another way to make money and then invest. So honestly, like for us, that's how it started, and we started doing CRO on the side. We got a couple of big clients from pharma as well as researchers here in Atlanta. Georgia Tech is one of our client, um, and then Emory University and so on and so forth. So that's how we started generating revenue. So we are actually a very unique case where we actually are funded by our own CRO business, but obviously that comes with its own challenges because then you have to pivot. And I know some VCs originally, they were kind of skeptical about this, that they were like, oh, you will not be, we were talking about focus earlier, right? So some of the rejections that we faced was because of the CRO business, and they were like, no, that just like divides your focus. And I'm like, wait a minute, you're not investing in my company, and then you're telling me to leave away the only source of income and like revenue that we have. So like, how's that working out? Anyhow, so we started serving as a CRO and started reinvesting that into our company, and that's how we had our resources. And now we are at a stage where we are growing, so obviously now we are trying to raise more funds to grow. Obviously that's a sustainable business that we have, but for and this gave us time to actually decide go no go strategies for a lot of our molecules, vaccines. And we have I'm proud to say that we have almost like 5 different vaccines and like 5 different antiviral therapeutics for various, infectious disease indications. And a lot of government, federal agencies as well as VCs have shown interest in them. So we are now at a stage that we are choosing to go to VCs. It's not that earlier we were rejected or anything, but yeah, we were like, okay, let's keep doing our CRO so long as we can, and then for the growth we will go to the VC. So yeah, so we were kind of an unusual space there.
Yeah, that's outstanding. And I like your description of it kind of being a non-traditional funding path, at least for biotech, right? Because I feel like a lot of us think there's research funding, and then maybe there's non-dilutive SBIR grant kind of stuff, and then there's venture capital. But we forget sometimes that you can be a normal business as well if you've got services or specific, research that you could offer. So I think
Exactly.
Arnav's a really great example of that. And just to poke on you one more topic of that, I really like the way you describe kind of being in control of the conversation with VCs. Now you have a sustainable business, and so you're offering a little bit of a different package. Have you had different reception from the investors that you've spoken to now that you are a more mature business and you've had this kind of track record of success with clients?
I would say so, yes, definitely. I think they are now recognizing that, I don't know like what's going on in their minds, to be honest, but that's what I'm perceiving. They
Hmm.
definitely they're more receptive of the idea that, like, you know what, if they can be doing this for like 4 years, there has to be some merit in what they're doing. Of course, there's like ups and downs in the model. That's why I'm saying like take it with a grain of salt. But if you
Yeah.
have a good product or something that you can sell, please do that. And obviously like in I think like just like democracy, right, any healthy company or any healthy set of co-founders must have some kind of disagreements. And my PhD mentor, Dr. Sri Singh, our CEO, he's, I think, the nicest, the best mentor I could have asked for. I don't know, might have done something good. But we were I was disagreeing with him, but he was like, no, we should not lose equity so early until we have our products, like at a stage where we are confident, so on and so forth. And I was like, no, 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 let's, you're when a scientist starts a company, there's a lot to learn and unlearn as well. So we were like originally thinking of like not losing equity, and now I see a merit, and now I'm like so thankful that I like sense prevailed and listened to him. We own 100% equity of ARNAV to this date, zero debt, $0, and we are functioning for last 4 years. So definitely the VCs now I talk to, they're definitely more, they're valuing what we are doing. And of course, this gave us more standing. We are, proudly standing here for last 4 years. So we are more in people's eyes, so to say. And then they're recognizing the technology that we have, the kind of vaccines we have. And obviously the clients or the collaborators that we had, they used our mRNA to file, IPs, go on raising funds themselves. So they are our cheerleaders to, go and talk to their VCs who they might have gotten investments from. So definitely, yes, there's a shift that I'm seeing.
Yeah, for sure. And I think relationships with investors are not sort of a one snapshot kind of thing. You often are sort of building a relationship over sometimes years before someone might take the chance to sort of to take the next step in investing. So Gaurav, I know you, like we said, you mentioned the I-Core program. How did that accelerate your journey to your seed round? I mean, were you already in touch with some of these investors when you were making this pivot? How did that all kind of come together?
Yeah, so I mean, we'd started iCore actually just that was from scratch, seeing we've done the research. Now we're asking really what is the business question. But I agree. I think people underestimate that pharma is still very much a people's business. It is a relationship-driven environment, and relationships will always prevail. And I think I really saw this in investment banking. I mean, that's where it really I could just see the deals, happen. And as I was working on them, like the reason it's happening is because the CEO of this company and the director are friends. And so that's how that relationship started. And then you see where these transactions kind of play out. So we really took a deep focus on that ever since we started the company and well before that. So even the folks that I met in iCore are still my contacts to this day. So, these are relationships that have been built over 3-4 years now. And then there's people from before that, and of course, people after that. But there's never a world where you meet someone in one shot and then things always work out. If they do, that's awesome. And, that kudos to whoever is able to do that. And sometimes, that happens. And I think luck's in your favor. But the reality is most things are you meet someone, you get to know them, you try to understand some of their problems, and then you cultivate that into a relationship that could pan out a few years down the line. And that's true in personal life as well as professional life. I think that's just the motto for everything. But that's how it started with even our investor. That's how it started even with the funds that we still know, that we're chatting about, a raise that probably will come soon down the pike. There are funds that, passed a lot of funds that passed on us in our original round, but I still know them. And, we really took their feedback to heart. And I think that was actually one of the biggest lessons I'd learned during raising, and even during iCore, is to not take things personally. I think that's huge, especially when you spend, for a lot of scientists, when you spend a decade, for example, studying one problem and someone just comes and barges down on you on that, you really can't take it personally because some people, have 30 years of experience or they have tunnel vision to see things one way. And the lesson for me was always to try to distill what advice I could get out of it and then take that to the next thing. And that's really, I think, been key in why we've been able to navigate a lot of the relationships that we have with the pharma companies we work with, and even with the funds that we've known over the past few years. So I think that has really been key. And you see this in finance, you see it in consulting, but it's true even in biotech and many other industries that everything is about people-to-people interactions. So one Zoom call is not going to cut it.
Yeah, that's a great point. And I think I've been thinking about that as well lately, where even if you have the greatest data package in the world, maybe people will come running. It sounds like Eric is a great example of people kind of seeking out the incredible science he was doing. But ultimately, it's people that are going to make decisions. Maybe it's not one person, it's a committee that's got to vote on something, but they're still people at the end of the day, right? So they need to be excited to work with you and feel really confident about the relationship. And so to that point, Eric, I know you have an interesting experience of being sought after for some of the work that you were doing by pharma strategics, and then eventually working with the venture creation firm Orange Grove, kind of doing that. What was I guess, the difference in the tenor of those relationships, working with the pharma group, working with the venture creation firm? How did you kind of balance the maybe even competing interests of those with your own team? What was it like to sort of handle those dynamics as at the start of Allonix?
Well, that was interesting. Yeah, it was certainly multifaceted. So one reason that we chose Orange Grove, well, the major reason was the relationship that we could see ourselves building with them and the sort of the common goals. And I think, one thing Gaurav mentioned was the idea that you have multiple meetings with people to really get a sense of their personality, their commitment, and then where it's like a marriage, like you're going to be together for years, and so making sure that you align in your philosophy and really the end goal is really critical. So Orange Grove, I felt that with. Another major factor though was that Eli Lilly, which was our pharma partner initially, was already invested with Orange Grove in another technology, another company. And so I got to know the therapeutic area immunology really well, the scientists there, the bioinformatic team there. For a year and a half, we worked together. Business development is a totally separate team. Just like Emory, we have different departments, within Lilly. I mean, I don't know how many people are there, 12,000, something huge, um, but it's also fairly segmented. And so the Orange Grove team had a different set of connections, more on the BD side. And the BD side didn't talk that much to the therapeutic area that I was working with. Um, but but once we started getting everybody together, we realized they could be very, very synergistic. And so um, there was a point where we made the decision to go with Orange Grove.
Mhm.
Emory was extremely willing to work with the academic founders, John and I, to support whichever path we chose. They could see themselves making a license deal directly with pharma or, with a newco. And so they waited on us to make that decision. We did, and then everything sort of realigned. And I don't know, this was a long negotiation actually to sort of settle on licensing terms. But everything worked out, and and I think it was nice to see everybody working together, pharma, Nuco, Emory, um, understanding that while things seemed tense maybe and slightly contentious on certain points, everybody's goal was to get something into people. So in the end, everything hurts a little bit, but everything, is lined up so that we can have success. And I felt like that's the deal that we landed on ultimately.
That's great. Yeah, it certainly helps to kind of zoom out occasionally and say, all right, what are we really trying to work for here? Are we really aligned in the end goals? And maybe a follow-on to that, Eric, is Orange Grove the type of firm that also helps with kind of team building? Did they add members to your management team? Or if not, how did you go about kind of fleshing out the rest of your team, especially since you're not playing a day-to-day operational role in the company?
Yeah, that's a great question. So Orange Grove is one of those venture capital models where they have, in-house expertise in most of the areas needed in order to drive something forward, to market. So they had maybe 40 to 45 internal experts covering quantitative biology, toxicology, pharmacology, medicinal chemistry, and clinical expertise, and marketing, legal. So when we decided to form Allonix, we had 10 members instantly. And we were, of course, part of the process in deciding who would join from Orange Grove, join Allonix. Some members gave 100% effort. Some members were, 50% or a third effort, with that effort floating between one or two newcos spun out of the Orange Grove model. So I think it's done not too often. In our case, John and I still don't regret doing it this way because we aren't doing the heavy lifting, for fundraising. All the CROs we have to work with. For us, we have lots of chemistry happening, both at the discovery side and also the scale up, and that's a whole nother thing. Pharmacology, toxicology gets handled by the Allonix members that come from Orange Grove, and so that's been really positive for us. All of the Orange Grove team members we worked with have been excellent. And I also get check-ins from my CEO. How's the team looking? Is there anything that you think we could do to enable better communication? Should we make a switch? What do you think? And so that check-in is also really important. So I've had good communication with our CEO as well.
It's great. Yeah. So it sounds like that model of kind of venture creation and team building was really helpful for you sitting in the academic setting. Gaurav, maybe same question to you. How did you build your team around you? Were your investors involved? Were they people that you knew from other points in your career? How did you kind of put that together?
Yeah, so the founding team is me along with three faculty at Georgia Tech. And so they still stayed on as faculty and did not join the company full time. I'm sure that's a pretty big risk to take, which I was willing to take and, try to flesh out this team. But Saad was who I'd first started working with. Cindy Sindel is in Georgia Tech's, I think, Quadrant I, leading a lot of the initiatives in biotech. And then Mark Prousnitz is the last co-founder. And I think that core team was pretty instrumental, mostly because we all bring such different areas of expertise. And VCs, as we say, they invest in science, but they really invest in teams, because the science could be, 50% of the way there, but as long as the team's there, they kind of, at least from my, estimation, a lot of them just bet that the team is what can carry this forward. So we tried to really build that out. So, we had the founding team that we've been working together for 5-6 years, I think, at this point. And then now at the company, we've been strategically tacking on people. But we've taken a bit of a hybrid approach, which is one, we have people working for us full time, but we also have an entire network of experts and consultants we work with. And I think the real value of that is efficient capital allocation, which I think can't underscore enough, I think, in this environment. A lot of companies that came out of 2021 assumed that cash would be infinite and just running to them. And all of that disappeared. And that's why those companies then fell, even in my lap at a bank, trying to figure out how do we stretch every dollar further. And so we really, I think, take that mission to heart as a company in Atlanta, which is how do we push every dollar we spend, 2 or 3 times further than a peer in Boston or a peer in California. And so we've taken that model by tacking on one person at a time for a key function that we need support on. And we think very diligently about whether this person needs to be full-time at the company or if we could tap into an external expert. And I think this is particularly relevant for us as a platform company that, does have to stay focused on things because there's so many different things we could go after. But also because the regulatory pathway, as for any drug product or delivery system, it's a long regulatory hurdle. It's not the same as a conventional medical device. And so there's a lot of things you have to figure out on the CMC side, the safety tolerability side, the regulatory side, research, business development, legal, accounting, all these functions that have to be there, but they do not have to be there full time. So we've, I think, been very successful, at least in sourcing all the key people, including folks who worked for our competitors. So that gives us, I think, without, of course, disclosing, any material information, but at least, people who are willing to leverage their expertise, decades of expertise in industry, but doing it to, multiple different companies at the same time, so you can split around those costs. So we've tried to really take that model and implement it as efficiently as we can. And so, with our seed round, we've been running for about 2 years now, and we still got runway to go. So that's something that I emphasize to a lot of funds as well. And, Pooja can speak to that even better without having raised a round, which is we're able to run very efficiently in Atlanta. Whereas you could take a Boston company and they'll turn $100 million out in 2 years with very little to show for it. So that we do not want to do that. So we really try to make dollar.
That always boggles my mind. I don't know if you heard about, I don't want to name this company, but there's a company that raised, I think, $480 or something. And they're like, oh, crap, we don't have enough money. And I'm like,
yeah, exactly.
I will never wrap my head around, like, how can a company in 1 year spend $480 million? And they're like, oh, well. And I'm like, and here we have trying to convince investors to invest like $4 million, let alone 400.
Exactly. And I think that's also where there's a difference between, venture creation studios, say like Flagship Pioneering versus traditional VC investments. And that's because these funds own the whole, at least in a lot of cases, they own the majority of the company. So that gives them the flexibility to do what they want operationally. And also means that they're able to see returns in a much larger fashion because they have that large stake. And that's why they're really willing to write these checks. Whereas if you look at more nimble funds where they're taking smaller stakes in established companies, that's where the diligence will be, even harder. So you'll see 100, 200 million flow into companies with just ideas, but those are coming out of these studios that incubate the company themselves. They insert their own team. And if you actually read the bankruptcy filings of these companies, you'll understand exactly where that money went. I did. I bought it because I wanted to know. And, I would love to buy Herman Miller chairs, but I don't think it's the most efficient use of capital. So that's where some of that money goes. And the last thing I'll say.
That's like,
yeah,
that's a case study to run successful companies with lesser. It can be done. That's the point I'm trying to make, right? Is this like said? Well, but of course, it's like somebody who's always been living a lavish lifestyle. They wouldn't know how to drive a $20,000 car if they've always driven something that's 100,000. So, anyway, that was just like on a lighter note, not to like name calling anyone, but.
No, it's totally fair. And I think, even with a company like us, like say, miraculously we get 200 million. I don't think I'd run the company any differently than I am now. I mean, just because you have more money doesn't mean you need to waste it on things that just don't need. Like we'll still buy used equipment. We will still use, part-time.
That's the point I was trying to make.
I think, exactly. I think the amount of money you raise shouldn't impact, how nimble you run. And that's why companies churn out maybe 1 or 2 drugs despite raising hundreds of millions, whereas there are some very efficient companies that know how to take something from early stage through development with much less capital. And I think the key to that, and that's key to any startup, is failing fast. I think that's huge, is especially if, and I think for a lot of scientists, it's sometimes very hard to let go of what you've been working on. But the reality is that sometimes things work incredibly well at the bench, but the reality of its translation of the clinic is entirely different. And so understanding that gap and understanding it as early as possible is critical to be able to continue progress in the company and pivot to where you need to go. And a simple example of this is, as a scientist, we always think a lot about just efficacy. That's it. Sometimes that's where the buck stops, is what is the highest performing candidate that we have. But when you get to the clinic and when you actually get into markets and you look globally, that's not always the driving factor. And the easiest example of this is, Moderna and Pfizer's vaccines were in the United States, made with mRNA, quite expensive, not very thermostable, and the durability wasn't as strong, but they had, headline numbers, 94, 95% efficacy. But if you then look in markets, say sub-Saharan Africa or India or other countries where the same infrastructure doesn't exist, and particularly where logistics are a very big challenge in getting to that last mile, an mRNA vaccine is simply not feasible. I mean, you can barely transport things at 2 to 8. There's no way you're doing minus 80. And as a result, the AstraZeneca and J&J vaccines, or even the Novavax vaccine, were the ones that got translated. So you see there's different drivers that take place in each market, and it's not entirely efficacy driven all the time. Sometimes it's safety, sometimes it's cost, sometimes it's logistics. And so understanding how your internal development pans out in that long-term horizon, not just from your efficacy numbers, but also from these other components, is key to really analyze whether you should continue doing this or whether you should look at something else that might have a more unique value proposition. And as a company that's developing a platform, understanding each value proposition and where it fits in for each therapeutic area or each candidate is crucial. And I think that was the biggest learning that we've gotten, over the past 2 years versus what we did in academia, which is we thought, great, this one thing is going to work. It's going to work in this one format. We'll have a self-administrable device that will work in every clinic around the world. And that's still a long-term goal, but that's not the first product. And understanding why it's not and what we can do in the meantime that could easily drive value for pharma companies and end users is pretty key. So
that's great. I think there's a lot of good stuff in that conversation. It feels like 2 themes are kind of emerging from today. 1, you've got to be nimble and you've got to be ready to kind of pivot. And 2, you've got to be scrappy, or to use Gaurav's finance terminology, efficient capital allocation. I like that, Gaurav. This is really great. So we've got about 10 minutes left. For the audience, please feel free to shoot some questions either into the Q&A or into the chat. I did want to leave some time here. I don't see any open questions right now, so I'll keep going with a couple of mine. I want to turn back to Eric in a bit, since you're still actively performing academic research. Has your experience with Allonix changed the way you think about the research going on in your lab, or do you really keep those 2 streams pretty separate?
That's a really good question, one we struggle with constantly. So, the first switch we have to make is to make sure we move mentees and trainees that need to publish off of development efforts. Unless we can make sure they're going to get enough of what they need publication-wise to be able to graduate and move on to the next step of their career. So that's something we struggle with. But it definitely has opened up our eyes in terms of the possibility of translating everything we're doing potentially into a therapy. So now that we know a bit of the process, we definitely, across multiple efforts in our lab, have gone through the exercise to decide whether or not this is something we should apply to Biolocity for, or write an SBIR for, maybe instead of an R01, to start doing some of those things that we need to do to translate, either a small molecule, a protein design, or an assay that we've come up with, to something therapeutic. So we're definitely thinking about it more. And also because you meet different people have different sources of funding. And so, and now I'm exposed to additional revenue streams that are not federal grants that can support feasibility studies and like initial translation studies. And so we have, as at least one or 2 other efforts now in the lab on that, which would not have happened, I don't think, unless, prior to us actually forming and co-founding this company.
That's really incredible to hear. I know it's a huge goal of ours at Biolocity and a lot of other folks that work in this space to sort of generate these, if not serial entrepreneurs, serial innovators. Because I think once you've been through it before, you do look at the world a little differently and say, okay, how can I apply this research toward a more commercial setting? How can I reach out to partners that could help accelerate this with me? So I'm glad that that's sort of reframed how you think about some of this. All right, in closing here, there's a couple of just sort of general questions I'd love to ask each of you. And the first one is, knowing what you do now, if you were to go back, 7, 8 years, wherever the beginning of the story started with each of you, what would you do differently, if anything? What sort of roadblocks could you see now that you would try to navigate differently, or people you try to talk to? Yeah, how would you handle that? Maybe we'll start with Pooja.
So honestly, I would have done this sooner.
Oh, really? Okay.
Yeah, honestly, like I think so. To be honest, like I always wanted to do this. I just didn't know this exact framework or the wordings that I wanted to be an entrepreneur. But now I realize I was a better fit for doing it this way than like being a professor. Because for me personally, I've worked a lot with like DARPA. So if you're ever worked with DARPA or like DARPA grants, they are crazy. They're like just, and that's the reason why we have like internet and like all the things that you name. That's like just changing. Like if you're a fan of Elon Musk, I like him and I dislike him for a few things, but anyways, that's besides the point. But like if you know like how DARPA functions or how Elon Musk, like I think in like last week, like in 60 hours, he has like back to back to back, like one or the other thing was just coming out of his companies. So if you're, I think I feel like I'm not no means no means comparing myself to him, but like I think that's the kind of like style of working I have, that I need to be challenged. If there's something that's just like status quo for like 2, 3, 4 years, I would just be like, oh my God, what's going on? There's nothing challenging. And I think you can't be challenged more than in a startup. When you get up in the morning and by the time you go into the bed, I think things, if they go as you plan, except for your meetings, that's a win. And Gaurav, I think, could relate to that. Like there would be like so many fires that you need to put off like on a given day. And I think that's the kind of challenge I would have enjoyed. And I would have started my company sooner. And second thing I would have done differently was that I would have gone after these non-dilutive fundings a little sooner. Obviously, we chose a different route of CRO and that worked out for us, but probably I would have written our SBIRs right after my PhD. That would have saved several years. And then, or at least like when I was in my postdoc and finally deciding that I wanted to start a company, I would have started doing those before I went into this full time. So obviously like getting a guaranteed source of funding, and obviously like government does provide that safety net. Of course, like if you have a strong technology like Eric and Gaurav, you would definitely attract funding. But sometimes the path that we have, like for example RSV, it kills like it infects like 60 million people every year, but it's just not a fancy virus, right? So there's still like I still struggle. But same thing we are doing for influenza, and we are getting like almost 10 times more interest, and I'm like, how is one virus that kills more people than like influenza? But it's just like the perspective. And then influenza being a pandemic potential virus, of course, scares all of us a little more. So I would have done that slightly differently, and honestly taken this leap of faith a little sooner.
Wow, a great answer. Gaurav, same question. What would you have done differently?
Yeah, honestly, there's not too much that I think would be done differently. A lot of things, it's not a straight line. It's not like we saw this when we started and said this is going to be a company at the end. It's gone, through its ups and downs. And then one day the light bulb clicked and said, oh my God, this could actually be something there. I think the one thing, you mentioned this earlier about keeping the company in Atlanta, it comes with its advantages and disadvantages. And I'm always blunt about this because, it can be powerful if you do it right to run a company in Atlanta, but at the same time, it's not Boston, and it's not California. And so the one thing not to say that I could do anything differently about it, but I wish the ecosystem building for biotech had started much sooner. Because when I had started, I didn't know the other founders in Atlanta at all. And now, we all see each other at events all the time. And I think the influx of both capital and different groups into Atlanta has really driven that. But before this, that was not present. And so I think building out that ecosystem to get to where Boston is at, is the dream. That's the goal. I wish that had started sooner. And I think that would facilitate, a lot of the advantages we see now with the ecosystem power. But I don't think I change anything. And to contrast this with, we're having worked at several other companies. this is 100 times better than anything I've done, but it's also 100 times more challenging. And so, to Pooja's point, you're always having to put out fires. There are things you're going to love doing, and there are going to be things you also don't like doing. I had to spend 3 weeks negotiating insurance for the company. Sometimes you just don't want to do that, but it has to happen, and there's no one else to do it. And so people say wear hats, but I think the reality is every hire at a startup is functioning in 10 different roles. And I think you need to be willing to step into that and just do it. Because if you're not, then there's a gap in the company that needs to be filled. And so that has been a massive learning. And I don't think there's really any way to be taught that. I think that's just something you learn by doing it. And that's kind of been the motto of, having started off as a bench scientist and then worked as a banker and then now here. No one really taught me how to do a lot of this, I think, and that's true for anybody in this position, is you just start doing it, you figure things out, you learn, and then you communicate those findings. So just like science, this is its own experiment. And I think, if I had to do it over again, I would. And I enjoy every second of it.
And just to add on to like Gaurav's point, that someone told me that in Atlanta, we're in down south, right? So people are really more polite, more humble. So everyone gives you a pat on your back. But if you get a dime out of their pocket, that's a success. So yeah. So, and then same goes for like, the ecosystem. And imagine I started this like in 2020, right? So
Yeah.
we were the first company at BioSpark. I always love to give them a shout out because we were kind of like growing out together. And yeah, Gaurav is totally right that like it was just, I was like, am I the only one? And when I told my boss at Emory that I'm leaving to start a company. I don't know if he was, so of course he was happy for me, but at the same time, I think he was a little bit shocked because I don't think like many scientists from their academic positions would do it. Like if you're not a full-time faculty is what I'm talking about. So yeah.
Yeah. The thing I'll add on to that is there's a lot of risk that you take. Especially having worked in a bank where your job is fairly secure, to a job where now you're having to think every day about what can I do operationally to make sure everything continues running smoothly. It's just an entirely different perspective. And then the onus just falls on you to figure all that out. And so, even when we started, I will admit, looking at leaving Atlanta, but we didn't. And we actually ended up at Georgia State. And so now there's a beautiful incubator here with many different companies that I think is now full. So we are fortunate to get, the space here, but I think that's a big thing, which is you're having to constantly face risk and uncertainty. But some of us, I guess, thrive in that environment, and that's why we choose to do this. And we love to have to keep figuring out complex problems.
Very cool. Eric, how about you to close us off here? Anything you would have done differently?
Well, I think we've heard some really great advice, and I love championing Atlanta, as hopefully an up-and-coming biopharma hub. It's really been a pleasure to watch this grow. I think it's very similarly, if you can run a lab, you have to wear many different hats. You can also, run a company at whatever level you choose. And so I'd encourage people not to be risk averse, to just go ahead and take the plunge and, give it a go. And so, likely you have what it takes, and both, intellectually and hopefully, with your enthusiasm and effort to sort of have success in this arena. So for this company, I wouldn't do anything different, John. I think I would still go with, the model that I've gone with, where I have sacrificed equity to do less in terms of running the actual company. In the future, maybe I would, do things differently, to take more of a role, but I would definitely have to scale back what I'm doing for Emory, because it's really not possible to do both things to sort of the fullest extent.
Yeah, that's great advice. And you're absolutely right. There are certainly trade-offs with either scenario. And I think that's a great place for us to kind of end on. For those of you in the audience, you're kind of looking at three outstanding founders who've had very distinct, very different paths to entrepreneurship. But at one point, they were all kind of standing in your shoes as well. So there are a lot of resources out there. There are a lot of connections, even locally. I hear your points about the Atlanta biotech ecosystem. And the good news is, I think it's getting stronger and stronger every day. So we're very lucky to have all of you as part of the ecosystem. I want to thank our panelists again for taking the time to chat today. It was a lot of fun to catch up with all of you. For the audience, please check out next month's Bench2Market talk on November 20th. You can find links on our website. And thanks again for your time today. Yeah.
Thanks, everyone. Thank you. Bye, John.
Awesome.
Bye, everyone.
Thanks, John. Bye, everybody.